Ladies and gentlemen, thank you for standing by and welcome to COVID-19 media briefing. At this time, all participants' lines are in a listen-only mode. After the speaker's presentation, there will be a question and answer session. Please be advised that today's conference is being recorded. If you require any further assistance, please press *0. I would now like to hand the conference over to your moderator today, Mr. Teddy Sean. Thank you. Please go ahead, sir.
Good afternoon. Thanks for joining the call today. On the call, we have Commissioner Jan Malcolm, Director Joe Kelly, Commissioner Steve Grove, and of course, Governor Tim Walz. As a reminder to reporters, we ask that you limit yourselves to just one question each with a single on-topic follow-up. And with that, Governor Tim Walz.
Thank you, Teddy. Good afternoon, everyone. Good afternoon, Minnesota. It's a privilege to be with you again. I know these stressful times, times of anxiety and the personal tragedies, it's, I think, good to continue to highlight things that are very Minnesotan and things that are going the way they're supposed to. And this morning, I got an opportunity to participate in one of those. As many of you out there listening know, that we've struggled to make insulin affordable to folks who, no fault of their own, need insulin to survive. And we've fought a battle with special interests and fought a battle sometimes against ourselves in our politics. But today's a day to rejoice. That is now a law of the land, and one of the first states to tackle this issue. So this morning I signed the Alex Smith Insulin Affordability Act. I was on a WebEx, so I was digitally surrounded by advocates who have now become friends, who've worked tirelessly on this legislation, and legislators on both sides of the aisle, in the House and in the Senate, who have picked this up and worked on it, who have struggled to find compromise and continued to work through it. And many of you may know, or if you do not, Alex Smith was a bright, ambitious young man, 26-year-old, out on his own, proud. He was unable to afford his $1,300 a month insulin, and so he died rationing it. And this happens, I've heard this story time and time again, because he left his parents' insurance at age 26. And his mom, Nicole Smith Holt, turned her personal tragedy, a heartbreak that as a parent I can't even imagine, and turned that into public advocacy to make sure that no other family had to go through that. And she made the case that no Minnesotan should have to choose between food, rent, and a drug that they need to survive. She fought this thing for the better part of a year and a half. And I'm just proud today that the legislators, the advocates, and the administration, we came together on a short and long-term solutions to the insulin crisis. It wasn't always a given that it would get done, but it certainly was for the advocates like Nicole and so many others. So this is a model, too, on how we can get things done. I've said that in the only divided legislature in the nation, the ability to work together is absolutely critical. If we retreat to our ideological corners, we can't get things done. This thing took us way too long. We eventually did do the right things. I would encourage all of us to continue to voice our differences in a constructive manner, to voice our differences by putting out solutions to problems that Minnesotans care about. And if we do that, we can get things done. If we do that in this time of crisis, like we've continued to, we can pull together and make the case that Minnesota is stronger together. And I would turn some people's attention, if you haven't seen it yet, our Minnesota sports teams, our professional and our university teams put together a video. While it will make you tear up, it'll make you look forward to when sports come back into our lives. It'll also show you what's really important about this state and about how we get things done. A couple other notes. I want to remind Minnesotans, MNsure special enrollment period is open. That's our state's marketplace. You can go there to get answers to your questions about insurance or choose a plan. In March, we announced a 30-day special enrollment period for COVID-19. Since that time, over 3,600 of your uninsured neighbors have been able to access private health insurance through MNsure. Over 10,000 more have applied for the public programs through that special site. But the deadline to enroll is Tuesday, April 21st. So please go online to MNsure.org to get covered. If you need help, MNsure has a statewide network of sisters, navigators, who can help you get through that process, and that doesn't cost anything. On another front, the DEED, Department of Employment and Economic Development, continues to lead the nation in implementing CARES Act as fast as possible. I'm proud to say that Minnesota is one of the first states to implement the additional 13 weeks extension to unemployment insurance that hits folks who are already maybe using up their benefits. Commissioner Grove will have a few more details on that and can talk through it on what that's able to do. But I want to thank them for the quick work they're doing. And again, continue to those of you out there listening, I get it very clearly. If we get it right 99 times out of 100, it doesn't do that one person much good. And I can tell you, though, that we are continuing to improve our processes, continuing to work basically round the clock and add more people to be able to do that for you. Also, a little different this year. It's April 15th. It's tax day, but in keeping with the federal extension, Minnesota is providing additional time until July 15th for taxpayers to file and pay their income tax without penalty or interest. Make sure, again, I ask all of you, if you have a refund, file, and I hope you've already filed, file early. The stimulus checks were based on either your 2018 or if you filed a 2019 tax return. So we want to make sure that we continue to track on that together. As Minnesota responds to COVID-19, we're providing grace periods where we need it. So please let us know. Please, the Department of Revenue, while they're working around the clock too, they're there to try and help. They've got committed individuals working with businesses too, making sure that you're not penalized for this and more negatively affected. So that's good. And then before I turn it over to Commissioner Malcolm, the next news I'm going to share is exactly where Minnesota needs to be. When I talked to you a little over a week and a half ago on the state of the state, I mentioned that Minnesotans aren't just going to get through this, that we're going to lead. And that has proven true this morning. The University of Minnesota has received FDA approval for the design of a new low-cost ventilator aimed at helping clinicians in settings where you can't usually get a ventilator. It's called the Coventor. It's the first of its kind to be authorized for use under FDA's Emergency COVID Authority. It was funded by the U's Rapid Response Grant that spurs innovation around treating the virus. A medical school resident and a College of Science Engineering colleague put together a team to build the prototype to be readily available, and they used the things they had in their lab back in March. They've now refined it to be desktop size. The Coventor is relatively inexpensive to manufacture. Its specifications will be put out on an open source online, allowing other manufacturers to begin their own regulatory and production process worldwide. So thank you, University of Minnesota. Thank you, Minnesotans, for funding one of the great, if not the greatest, land-grant university in the country, an innovator for so many years, an innovator, as I've often talked about with Norman Borlaug and the Green Revolution, an innovator in medical technologies, and again today, another addition to the global fight against COVID-19. So thank you for that. I spent some time this morning speaking with all the other governors, specialty hospitals, and after this call, I'll be speaking with Secretary of Defense Esper about the progress that Minnesota has made in our preparations. And to give an update of where we stand today, Commissioner Malcolm, please go ahead.
Thank you, Governor. Good afternoon, everyone. I will again start the briefing with just the global and national statistics. Worldwide, as of this morning, we had just over 2 million cases and over 127,000 deaths. In the United States, we are now reporting a total of 609,685 confirmed cases and just over 26,000 deaths in our country. Here in Minnesota, we have yesterday confirmed an additional 114 cases via laboratory confirmation, so we're now at a total of 1,809 cases. Unfortunately, we again today are announcing 8 additional deaths among our neighbors. So we now have a total of 87 total deaths in Minnesota from COVID-19. The 8 deaths from yesterday were again heavily concentrated in the elderly. All 8 were long-term care residents, 6 from Hennepin County, 2 persons in their 90s, 1 in their 80s, 3 in their 70s, and 1 each from Clay and St. Louis counties, 1 person in their 70s and 1 in their 90s, respectively. As of today, there are 197 patients currently in the hospital, 93 of those in intensive care. So as you can see, if you're tracking the numbers, both the total case counts and the hospitalizations do continue to increase, but on about the same pace that we've been seeing in recent days. And as of today, 940 patients have been released from isolation. I'd like to just close today my part of the briefing by commenting on the importance of infection control and the hard work that's going on in our long-term care facilities. As we've been talking about, we have a particular concern about long-term care facilities because the residents and the workers in those long-term care facilities generally face a population of higher risk people living in close quarters in a congregate setting, making it a particularly ripe environment for the spread of COVID-19 and other infectious diseases. That's why we've been working so very hard with those care providers to make sure that the facilities are implementing very strong infection control practices. And while by no means am I saying that we are out of the woods or have everything totally under control, we absolutely need to keep our vigilance, keep our guard up. We're stepping up every day, closer and closer collaboration with hospitals and long-term care facilities and across various parts of state government to make sure we're marshaling all of the support we can bring to these facilities. We are seeing some early indications that this infection control emphasis is having a positive impact. So when you look at the data again, we see 108 facilities in which COVID-19 cases have been confirmed. And as we have said many a time, we know that the total number of lab confirmations just represents a part of the underlying story. But of these 108 facilities with confirmed cases, fully half of them have only 1 case as of today, which really does suggest to us that infection control is helping limit the spread of those infections. We've still got a long way to go, a lot more work to do to make sure we're supporting these workers and these residents. But I think it's important to take a moment to acknowledge the hard work of those facilities, staff and administrators, and to thank them for all the work they're doing to help protect our loved ones in long-term care settings. And I also want to thank the MDH and local public health staff who've been working tirelessly to support them in this work. Thank you. And with that, I will pass it off to Director Kelly.
Thank you, Commissioner, and hello again, Minnesota. I'm going to spend my time today talking about a couple important Severe Weather Awareness Week topics, floods and tornadoes. I know our collective attention is focused squarely on fighting the virus, but as I've said before, we live in Minnesota, where the weather always has a vote, and we need to be ready for it, regardless of what else is happening. Today's focus is on flooding. Minnesota, as we all know, and we're proud of the fact that we're the land of 10,000 lakes, and that's one of the things we love most about this place. But from time to time, our water turns on us. And Minnesota is indeed one of the most flood-prone states in the country, but that's not news to anybody who has lived here for very long. And our fellow Minnesotans up in the Red River Valley are just coming out of their latest flood. It is our number 1 natural disaster threat by far. I looked at records for the last 10 years, and Minnesota has experienced 28 major flood and flash flood events that have triggered a state or federal disaster declaration. Flooding is also the most common, widespread, and expensive natural hazard across our country and around the world, especially if you factor in the storm surge flooding associated with hurricanes. There's 2 key flood messages I want you to think about. The first is turn around, don't drown. Never ever drive through floodwaters. You really don't know how deep the water is, what the bottom surface is like, nor how strong any current might be. Do not drive around road closure barriers. They are in place for your safety. So please turn around, don't drown. The second key message is to consider buying flood insurance through the National Flood Insurance Program. The standard homeowner or renter insurance policy will not cover you for flooding. Additionally, make sure your homeowner's policy has an additional rider for sewer backup. It's often not covered automatically. Sometimes it is, sometimes it's not. So as always, consult with your insurance professional and understand that FEMA disaster relief is no substitute for flood insurance. Tomorrow is our annual tornado drill day. Because of workforce restrictions, we coordinated with the National Weather Service and Wisconsin Emergency Management on a slim-down drill. So at 1:45 in the afternoon tomorrow, most counties in Minnesota and Wisconsin will activate their outdoor warning sirens and other notification systems. Keep in mind, the choice to activate sirens is a local decision made by counties and cities. The National Weather Service will also be posting some information on social media at that time, but they will not activate NOAA weather radio. At 6:45 tomorrow evening, many counties in Minnesota will again activate warning sirens and other notification systems. And same as in the afternoon, the Weather Service will not activate NOAA weather radio. In Minnesota, we do 2 tornado drills. One in the afternoon when most of us would normally be at work or school, and again in the evening when most of us would be at home. And we do that because we take different actions depending on where we are. But the drill is the same. Take cover and get information. When you hear outdoor warning sirens, go to a designated safe shelter at school, work, or home, and gather information from your favorite source, radio, TV, online, or social media. And in the days of COVID-19, please social distance as well as you can in your storm shelter. These annual drills are fundamental to being prepared for the severe summer season of weather that lies ahead for us. So please stay safe and, of course, stay healthy. I'll turn things over to Commissioner Steve Grove with the Department of Employment and Economic Development now. Commissioner?
Well, thanks, Director Kelly. Good afternoon, everybody. As the governor mentioned a moment ago, we do have some good news to begin our update today, which is that 13-week extension that came through the CARES Act for unemployment insurance has now been fully implemented into Minnesota's unemployment insurance system. What that means is if you are near or at the end of your unemployment insurance benefits at this point, all you have to do is log into your account and indicate that you're still unemployed, and you will be eligible for an additional 13 weeks of unemployment insurance. This applies to everyone in the state who is unemployed and is using the system, and you don't have to do anything extra other than just log into your account and let us know that you remain unemployed, which is something everyone has to do every week regardless. We think that we are one of the first states to implement this provision, and there are about 8,000 people by our count who have exhausted or will soon exhaust their regular unemployment benefits. So not a moment too soon for those 8,000 Minnesotans to get that benefit up and running. We've now gotten 2 of the 3 major provisions that came through the CARES Act for unemployment insurance. That $600 top-off payment that we announced last week, we were the first in the country to get that up and running, and then this additional provision for the 13-week extension. So we're continuing to work night and day to make sure that we get our system updated with these new benefits for Minnesotans. The last and probably the most asked about provision is, of course, this unemployment insurance for the self-employed and for contract workers. We'll have that up and running by the end of April. No state in the nation has got it up yet. It's complex, it's important, and we are making sure to build this really entirely new system for ensuring we can get those benefits out and prevent fraud night and day right now until it'll be up and ready. So more soon then, but we wanted to continue to let people know we're working on that, and we do encourage all those who are self-employed or contract workers to apply for unemployment insurance now. Even though you will currently not be eligible, getting your account up and ready and getting you into the system will only speed up our ability to pay you once we're finished with the build, and we'd encourage you to apply and not be discouraged by the fact that you're not eligible yet. We will proactively reach out to you as soon as those benefits are available. Today's unemployment numbers, we are at 464,513 total unemployment applications since March 16th. That's up about 13,000 from yesterday. Our top occupational groups represented are food preparation and serving, sales and service, healthcare, including both practitioners and support, office and admin support, and production. Wanted to turn to a moment to small business supports. as you all know, the Small Business Administration has launched several programs at a national level to help small businesses get through this time. And one of the most popular is the Paycheck Protection Program, which gives loans to businesses who need the money to continue to meet payroll. And if they keep people on their payroll and use those funds to make those payments, most of that money is actually forgivable. About 70% of that money has been called for nationwide, but I'm happy to report that Minnesota has the third highest loan dollars per capita of any state in the country for that program. So we've moved very quickly as a state to get lenders up and running, the SBA connected to those lenders, and ensure that we can help Minnesota businesses take advantage of this program. We've done, and by we I mean the SBA, this is our partners in the federal government, have done 33,819 loans. They've approved $7.6 billion worth of loans. The average loan size is 225,713. And the per capita number, which, again, as I said, ranks us third in the nation, is about $1,350 per person in the state if you just look at where we rank in terms of taking advantage of that funding. So we're very grateful to our partners at the SBA. Brian McDonnell and his team have done a great job of making sure that money is available to Minnesotans. There's some challenges with all these programs because they're large and complex, but getting Minnesota at the top of the pack of states that have taken advantage of that money is, of course, really important. And then lastly, just wanted to continue to celebrate Minnesota businesses who are doing great work in our state. Today I wanted to talk about Wintergreen, which is an iconic outdoor performance clothing manufacturer in Ely, and they have shifted to making protective medical gear, including face masks and medical gowns and headgear, particularly for Iron Range and North Shore clinics. They've done this for some time now. Owner Sue Shirkey has really been at the helm of this, using home sewers across the community in addition to the workers at her business to produce face masks for community members. And they're even using local sewing shops and quilting shops to come together to make these masks. So great to see businesses not only using their employees but also their communities to come together and provide for healthcare clinics at this time of need. With that, I'll turn it back over to Governor Walz.
Thank you, Commissioner. Before we take questions, I would just say, Minnesotans, what we're doing is working. And when I say we, I mean all of us. Our social distancing has bent the curve. We are still maintaining that lowest infection rate in the country. We are responding internally in government, as you just heard the commissioners talk about, some of the best, if not the best in the country, of providing that safety net, from unemployment insurance to the loans to working together. Our public-private partnerships are starting to bear fruit in producing PPE, in testing, and in innovation. And this is all key, that this sets us up to bridge to that next place. If we can continue to maintain what we're doing, if we can continue to do the things that have been asked, we are as well positioned, as I continue to say, to lead and to show people and work with our neighboring states to show how we can bridge to start bringing back some of the things that we know we want to bring back. And that's, of course, getting people back to work, but with an understanding that the social distancing and the work that we've done, we cannot lose all that we've gained. We have put this state in a position where we're saving lives, and we can do it as well as anybody, and we've proven that. So I want to thank you for that, and at this time, open it up to questions.
As a reminder, to ask a question, you will need to press star, then the number 1 on your telephone. To withdraw your question, press the pound key. Please stand by while we compile the Q&A roster. Your first question comes from the line of Carla Hout of Care 11. Your line is now open.
Thank you so much to all of you for your time again today and for sharing your expertise. I wanted to address what Commissioner Malcolm shared regarding the benefits and the so far preventative efforts so far at long-term care centers, and recognizing that while they are making that progress, you did describe it as a, quote, ripe environment. Given that, we're seeing in other areas of the country people electing to bring their loved ones home, believing that perhaps that might be a safer environment. Is that something we are seeing at all here in Minnesota, where people are literally checking out residents from long-term care centers? And if so, or if not, is it something you would recommend from a medical and safety perspective?
Well, thank you. That's a a perfectly understandable question, but I think we have actually been saying that we think that these long-term care facilities, they are working very hard to provide safe environments, and in many respects, they are the safest environment for our loved ones. We know it can be extremely disruptive and a health risk of its own for people to be moving back and forth among different settings. We have the staff, we have the vigilance around this. I certainly understand the concerns of families, and we have just urged discussion between families and facilities about their concerns. But in general, we again want to just stress that while all facilities need to be vigilant and we need to be helping those that encounter challenges from staffing or from spread, and we are doing that, that in general these we believe are good environments for our seniors.
Very good. Thank you so much, Commissioner. And I do want to pivot just a moment here, but to Commissioner Grove, recognizing that so many people are applying online, and I apologize, it doesn't directly relate to long-term care centers, but they are applying online for these additional unemployment benefits and are not receiving immediate feedback. I was listening to your hearing with the Jobs Committee at the Senate, and they're requesting that perhaps there be some response by deed to indicate that, yes, you have been heard, your request has been filed. Is there an option for that?
Well, it's an important question, and I think if you're referring to the Senate hearing, we were talking specifically about the language of that response, because obviously for unemployed individuals who are self-employed, they are hearing back a denial message at this time, and we've been talking to the team about how we could hard code and change that message to give people a little bit more encouragement. And we're looking into that. But I think more broadly, we're using every ounce of the day we can to actually build up the system that will provide unemployment insurance benefits to the self-employed. And any application made online does get an answer. We just know that the answer right now for self-employed people is a no, and it will very soon be a yes. And we just want to continue to share that message with the state so that individuals don't get discouraged and that they do apply. Many states are saying to people, don't even apply right now if you're self-employed. We just think that that's going to slow things down. We'd rather get you in our system so that the minute that build is done, we can begin to deploy payments.
All right, thank you.
Next question comes from the line of Tim Nelson of NPR News. Your line is now open.
Hi, thanks for talking to me. I am looking at the numbers, the testing in particular today, and from what we're hearing in the experts, it seems increasingly unrealistic to see a significant ramp up of testing by May 4th. The number of daily tests in Minnesota on average has fallen by a third since last week. Can you tell me, either Commissioner Malcolm or Governor, what's behind that drop? And is there something you're seeing out there that makes you think this is going to turn around in the next 3 weeks?
Well, you're pointing at what I'm seeing too, Tim, and that drop is one of the reasons why I'm lighting the fire. And I'll have to tell you, I just got off the phone with the other governors, the National Governors Association, and this is one we do amongst ourselves, and a lot of it stays internal. But what I can share with you is every single governor is expressing this deep concern. And I just want to level set for the listeners out there. Again, you have to know how we ended up here and how we're thinking about solving these problems to understand why we're making the choices we're making. We were told at the end of March that everybody who wanted a test could get one, and the federal government took charge of that. They stopped the supply chain lines. They took them in and they sent them to these private labs. That was going to be the plan. Well, apparently now they have given up to a certain degree on that, because yesterday the president was very clear and he said the states are responsible for testing. And so we have been under the impression for several weeks, and my sense of urgency over the last 10 days has been through the roof, that there is not going to be a federal response to this. And every single epidemiologist and every single expert in what needs to be done is testing is going to be a component, and Dr. Fauci said it yesterday, testing is going to be a component on the reopening up. We have resources unlike others with the Mayo Clinic, University of Minnesota, and some others. So here's what I guess, Tim, is what I'm saying is, I am asking to challenge this team in this state to break that mold of where it's at. I do believe we can get to that 5,000 number a day. And my expectation is just to even throw more sense of urgency on this before May 4th. The states are going to have to figure out how to do this. All of the listeners out there need to know that this testing component is the surest way to get back to normalcy. And it's one that we're putting all of our resources, we think, between what the resources the state of Minnesota has, the private health providers that we have that lets us pivot to some of the PPE that we need, some of the places that the citizens of Minnesota has put us into by bending this curve that will allow us to use a little more PPE for testing. And the Mayo Clinic's ability to do this is that we think we can get there. So I am still committed to ramping these numbers up seriously. I believe that Minnesota can be the one example of where this will work. So yes, and many of you know me, I'm not going to sell you something that's not out there, but I am going to push my team. I am going to push these researchers. I am going to push Mayo Clinic to lean into this, because to do anything less is going to have us stuck in this place that is unsustainable, and we can't get people back as fast. So Jan, I don't know if you want to add anything. I have laid out that challenge to our team, and they're working it.
Thank you, Governor. That's exactly right. And I will just reaffirm that the governor has been completely clear about what a priority this is. We do actually have additional capacity in the state right now to do more testing. There have been logistical challenges with that, with the supplies being in the wrong place. And I should say we have the laboratory capacity to do this. The challenge has been on the provider end, on the front end of collection of the samples, and so the governor's right that this too is related to the availability of personal protective equipment. It's related to the availability of healthcare staff to do the collections. But I mentioned on yesterday's call, we have a team working on really a comprehensive statewide strategy to how we're going to remove some of those barriers, how we're going to augment the capacity of the delivery systems to work on the collection end. And just within the last couple of weeks, several of our larger health systems have come online with their own testing capacity. So they are doing their part to build up the capacity to do more testing. We need to build a statewide system to coordinate the capacity that exists and to try to work our way around these supply chain shortages. So that's the effort right now, and I would just have to agree with the governor that this is an achievable goal.
Commissioner, I just wanted to follow up quicker. Are these logistical challenges? So, your average for a weekday last week was 1,423 tests per day. This week, the first 3 days of the week, it's 1,065. I mean, this number's going in the wrong direction. Is it the providers and the PPE that's the problem here?
No, very, very fair. But I think that what you saw in the last weekend was heavily influenced by the holiday weekend and just fewer providers being open to collect the samples and the lag in getting the samples back into the lab. So I think there was something quite specific about the last few days, but you're completely right. If that is not a trend that reverses fairly quickly, I will expect you to ask again, because you should.
Yeah, Tim, next week you should ask on this, and your answer to your question is right. I'm seeing the same thing you're seeing out there. The governors are seeing the same thing. Governor Kelly of Kansas said that she's using dentist 3D printers to build swabs. I mean, that's the kind of stuff that's holding us back. The testing has been a major failure in this entire approach across the country. But what I'm seeing is that as I look across Minnesota and I look across the resources that were there, with a strategic plan and some alignment here, I think it is possible, and I am doing all I can to get us up to that number. So my expectation is over the next week or so, you should be able to quote those numbers and see a change, because I can't emphasize enough to everyone, coming from CDC, coming from every single country in the world, this testing is a major linchpin to getting this right, and we're committed to getting it right. So we'll keep pushing it. I believe Minnesota can do this. If we do, we will be the outlier in the country, and I do believe we will be the one that is best positioned to safely start to move people back into the workforce.
Thank you.
Next question comes from the line of Emily Havoc of Tier 11. Your line is now open.
Hey, Governor and Commissioners. This may be for Commissioner Malcolm or Director Erzman. With the science so new on so many components of this, what's your confidence level that the serology tests we're going to be relying on will really be indicating a level of immunity that is sufficient? And what's the latest that you're learning on that right now? Do you have concerns about that element?
Governor, would you like to start on that, or do you want me to, Chris and I, to take it first?
Well, I would start on it. I have the concern too. I read the articles this morning that came out on this, and I think you have to be really careful. Commissioner Malcolm was really quick to point this out, that there's a bunch of these so-called tests that came out because of some of the emergency exemptions, and some of them are just plain worthless. And so it's going to depend on the quality of the test. It's going to depend on the validation of the test. I think the one good news is here, you're looking at places like the Mayo Clinic and the University of Minnesota who are working on these, and I think that's the direction we would go. That's just the test itself. You're right. I do worry about the belief that you've had this, you've got the antibodies, you're good to go. We don't know that. We don't know that you can't get it right back again. We don't know that how long your immunity lasts. But I just think with so many of these, and they tend to play this out, and again, Chris is a better person to speak to the science behind this, is there's a good probability that there will be some immunity that comes out of this. There will at least be an acknowledgement of who's been exposed. So yes, your question is well taken. It is so new. There's every reason to not, this is not a panacea. This is not the easy fix. It is promising, but there are reasons to be skeptical about the tests first and foremost, and there's reasons for more research on the long-term immunity or validating some of the tests. Chris or Jan, if you want to add anything.
Yeah, I'll ask Chris to comment as well, but just to reinforce what you just said, Governor, the the fact that the U and Mayo both have serology tests with the testing, the actual high quality, high sensitivity tests that they're developing that we have a lot of trust in, but also they are leaders in the research effort that the governor just talked about. Mayo's leading a whole lot of the applicable research into answering those very questions. So I think here again, we will benefit, we intend, from being close partners with Mayo and the U and with our other health systems to make sure that we can apply some of that research real quickly. Chris, would you want to add anything?
Sure. I'll just reiterate what both the governor and the commissioner said, and that is that not all serology tests are created equal, so it's important that you recognize that, yes, because there was some flexibility given by the FDA, there are many tests on the market. We do have some information on our website pertaining to serology tests. It's designed for the healthcare sector, but it provides some good information. The things that we don't know about serology testing, even when we have a great methodology that's validated, we're still learning about the level of protective immunity. So how much antibody do you need to have protection? And then, as both the commissioner and the governor said, what is the duration of that protection? So those are all things that are being evaluated now, and that will all be included as we're looking at how we can use serology testing in Minnesota. The one thing that I do want to say is that we've been made aware that there is some serology testing that's out there, and that individuals have received, the results of their test with a letter that says, you've been tested for COVID, you have immunity, you don't have to social distance now, everything is great. And we want to be clear that we aren't at the point where there's a test that's out there that could provide that kind of information to a patient. So please, be very cautious in taking advantage of serology testing. There are a lot of limitations at this point, and when we get the information that's important for the public, we will make sure that that goes out in a very clear way so that we can all take advantage of this tool when it's the right time.
Thanks to you all. And just to follow up on that, Governor Walz, when you talk about the numbers of, needing 5,000 a day, 40,000 a week, what kind of ratio are you thinking in your mind about, I guess, diagnostic testing versus serology testing when you talk about those numbers?
Yeah, the serology testing would be much bigger is our hope, and Mayo, as we've talked about that, is ramping those up into the tens of thousands. And I think Chris brought up a good point. Day to day, we're getting more information and it's getting better. My hope is that here in the short term, we can get to the point where we do have a little bit better certainty about how much immunity you have and the accuracy of those. But the tests on the front end, the 5,000, that's a number we think we need to get to. We think we need to be doing about 35,000 a week to start getting the saturation that we need to start being able to, the sentinel testing and some of the other things we're doing are really good. But I just think for so many Minnesotans, this would be the best way. So we've talked 5,000 and 40,000 between and then Commissioner Malcolm's, of course, talked about the point of care. And I saw today that New Jersey was just approved and started using the mouth swab test today. And so our goal is to stay on the front end of testing and to adapt as it comes online.
Thanks very much.
Next question comes from the line of Matt Sipek of Minnesota Public Radio. Your line is now open.
Hi there, governors and commissioners. Does the State Health Department plan to collect and track the results of these serology tests once they're up and running, and will that be included in the daily postings to the data dashboard?
Chris, I'd ask you to weigh in on that, the degree to which the serology results will be incorporated into some of our tracking mechanisms.
It's something that we would have. We certainly can do that because it's not right now. Our communicable disease reporting rule focuses on providers, laboratories reporting disease to us, and this is just slightly different than that. But we certainly can look into having a mechanism for that, so that we would, because it's very important information. It's information that we care about, and obviously that everyone across the state would care about. So we will look into the mechanism for us to do that in the same legal manner that we handle other disease reporting.
And to follow up on the serology, what supplies are needed? I mean, what's the number one or two things that are needed the most to get that test ramped up and running to that 5,000 a day, 35 to 40,000 a week that you want to implement here in the next couple of weeks?
Chris, can you take that one?
Sure. Well, the thing about serology is you don't need a nasal swab, and that's been one of the challenges with the molecular testing that we've been talking about. It's usually done as a blood test, so that there certainly is personal protective equipment that you need to be considering, but it's different than a nasal pharyngeal swab. So that makes a big difference. So, and the testing, the reagents, it's a different set of reagents, and so there should not be the problems that we're seeing right now with the molecular PCR test that is currently being used to identify current cases.
So there are enough reagents to go around to reach that level that we're hoping for in Minnesota for the serology test?
Yes, it's a different methodology, and so it puts us in a much better place. And as I said, it doesn't require that added swab step, which is just one more element in the supply chain that can go sideways.
Okay, thanks very much.
Next question comes from the line of Jeremy Olson from the Star Tribune. Your line is now open.
Hello, Governor. A week ago when you did your presentation on the extension of the stay-at-home order, one of the more shocking graphics that you put out there was the PPE levels, if only because by one scenario we'd run out of PPE entirely by the time the peak comes around. By the other, we'd have enough. There was a huge variation in what's possible. I'm just wondering, with a week's time, if you have a better sense of our PPE supply, whether it's going to be adequate, whether more is coming in. Maybe Director Kelly could address that as well. I mean, we've had some technological innovations to help stretch our PPE supply, but still, are we getting enough based on the last week and what you've been able to see?
Yeah, it's a great question. I'm going to turn it over if Joe, and I don't know if he has Commissioner Roberts Davis there who's doing on the procurement. The good news is that they are doing a good job with that. They're turning over a lot of things. I think there are more leads. Again, as we stated, if we could not be, at the peak point when other states were, that like New York, California, Florida, that would open up some of that too. So I don't want anybody to rest on our laurels, but I am feeling more confident than I was a week ago. As you said, when we showed that, those were the things that keep you up. I think there's reasons to believe that we are building towards the capacity we need, but it's still an unknown. So, Joe, are you on there, or Commissioner Roberts Davis?
This is Alice Roberts Davis. Thank you, Governor. I would completely concur. I think that we are in a much better position than we were a week ago or 2 weeks ago. We've really focused on finding those PPE suppliers who are trusted and who we know can get us the inventory that we need into the state. We're feeling really good about some corporate partners that we've been able to leverage and leverage their supply chains as well. And so we are starting to see a pretty steady flow of PPE into the state that we're able to get to our frontline healthcare workers.
Can you be more specific on those corporate partners? I mean, last week you talked about the Chinese army surrounding a plant where one supply was. So if some things are not available, what are the new doors we're opening up? Can you be specific?
So there are a number of Minnesota companies who stepped up and said, we have partners in Asia, we have partners all over the world who we know and trust, and we can get you connected with their supply chains. In some instances, they've been able to go into factories and ensure that they are manufacturing there and that the quality is what we would expect, doing some fit testing for us for masks in particular, and then ensuring that they're able to get them into the country for us, and so running the supply chain process of it as well. So we've been very fortunate to have those partnerships.
Thank you.
Thanks.
Next question comes from the line of Joe Nelson. Your line of Bring Media News. Your line is now open.
Yes, I was just going to ask a follow-up to the serology question. I know you've talked about the hurdles that need to be cleared so far, but and as Governor Walz mentioned, Mayo already has 7,000 diagnostic COVID-19 tests ready to go per day, the capacity for it anyway, and 10,000 serology tests per day already right now. But assuming the most vulnerable people in our population still have priority for those tests, how would you plan on getting everyone else lined up to get a test? Any idea what order that would go in and what criteria will exist?
That's a great question, Joe. I'm going to leave that to Jan because there are protocols for exactly this type of decision making. And, my goal is to get to the point where, we told we could, is that we want to expand this as far as possible. So, Jan, maybe talk about how we prioritize this, because I get texts and emails all the time from people who really want a test, and I think we want to try and get them one.
Yeah, absolutely, Governor. And I'm going to ask Chris to chime in here too. Because we have revised our prioritization criteria a couple of times, frankly, in both directions, restricting it when the PPE supplies became acute. What the work that Commissioner Roberts Davis and colleagues are doing is incredibly helpful. As I think several of you have described, it's one issue after another, and a very complicated supply chain to try to trace down. So that's really important progress that Commissioner Roberts Davis is reporting. But in terms of the prioritization criteria, we started off saying, well, with the most important thing is to test those individuals for whom a positive result is really significant in their care. So it was not a priority to test any symptomatic person who didn't have symptoms severe enough to go into the hospital, for example. So that's the kind of issue where people, I think, are frustrated that they want to know, if they've been exposed to COVID or not. And those kind of mildly symptomatic folks not in the hospital, have not been a priority for testing. We'd like to open that up. We've had priority on people in the hospital, also people in long-term care or other congregate facilities, and healthcare workers. Those have been our highest priorities. We've also said, again, because of the importance of other at-risk settings like homeless shelters or critical service industries like childcare, where it's just really important to keep those capacities available, but that we've added those folks as well as first responders, not just EMS, who've always kind of been on the list, but police and fire and other first responders. We've added them to the priority list. So I will be the first to acknowledge that we've had to restrict the list more than we would have wanted at many points, and we're now at the place where we believe it's important to, and we're able to, because of this added capacity that we've talked about coming online just recently, we're able to expand that priority list now. So, Chris, do you want to clarify or add something?
Well, the one thing I'd add is that as we look at serology testing, then we're looking at who do we need to test to diagnose disease, and so we've identified priority groups. And when we look at the potential for serology testing, the one good thing is that the capacity that's projected is, a magnitude of order greater than what we currently have for the molecular testing. So that'll make a big difference. But certainly, as the commissioner talked about, we are very interested in making sure that our healthcare workforce is able to be tested and know their status. That would make a huge difference for them and for just feeling their comfort, even as we're dealing with challenges with personal protective equipment, essential workers, and certainly, as you've said, the people that were at the most concern and the greatest risk for severe disease are the same people that we want to make sure that we know have protection, because that will make such a difference in their lives. But I think that the bottlenecks that we've experienced up till this point with the molecular testing, there's certainly, it won't be just, drinking out of the fire hose, but it will be so much different because of the capacity that exists for this type of methodology.
Thank you very much. I appreciate it.
Next question comes from the line of Bill Werner of Minnesota News Network. Your line is now open.
Hi, Governor. Thank you. Kind of a two-part question, both going on the area of testing. First, and I think most of us on this call understand this, but maybe you could explain to Minnesotans, you said testing will be a factor in reopening. I assume you mean letting more people get back to their jobs and so on. Would you explain in a layperson's terms why that's going to be so important? The second part of the question deals with, you probably are aware that your counterpart in Iowa is asking the USDA Secretary to send more testing supplies there to use at meat packing and food processing facilities. I'm just wondering what you're doing here, and will serology testing factor into that perhaps more prominently than the molecular, and are you going to ask for federal assistance, or is Minnesota going to have to go it alone in this case? Thank you.
Well, thank you, Bill. I think Minnesota's going to have to go it alone. I mean, the president made that very clear yesterday that the states are responsible for this. We have been asking, way back to the first part of March, when we were being told that they were going to ramp this up. Now, if you recall, there's public statements that we were going to be testing 3 million people a day. We've tested 3 million total since this thing started in the United States. So we are going to have to go it alone, which is fine. And the way this is going to play into it, when I talk about that, Bill, I think they go hand in hand. That until we get a vaccine, we're going to have to be able to identify who's sick. We want, and we think it's possible to identify who had this, even though that work coming out of Reykjavik in Iceland shows that maybe half of the folks there never experienced any type of symptom, but they had it and they're over it now. So the molecular, the PCR test that Chris keeps talking about, and then the serology test, these are two different ones. Those things can go hand in hand. That we could be able to do is we could test a workforce going back that is practicing social distancing, that is not coming in contact with one another, that are decontaminating their production facility, and then we would be able to know when they came in. We'd be able to use temperatures when they come in and when they go out. We'd be able to use software programs that are able to log these people with their employers, that they're helping manage this. And then should we get someone who develops symptoms, we should be able to quickly test them, quickly trace who they had contact with, and isolate those people. And we don't have to shut down everything. We don't have to shut down everybody. So I think those who are clamoring, and I would include that to be every single one of us, to try and move back to a sense of normalcy, you can't just say you want to restart, because then you end up with a Smithfield situation. It does us no good to send everybody back to work and then get everybody sick. What it does do us good is to be able to send folks back to work who, one, may be immune because they've had it, two, have just been tested and they're symptom-free, and three, we have the resources necessary should someone get sick that it doesn't become a hot spot. So that's when I keep talking about these things going hand in hand. That's what all of the experts and that's what people are trying to get to. But the thing that's holding us back so much, of course, is the question that Tim and everybody else has asked is, it doesn't appear like there is enough to do it out there. The difference, I think, here is in Minnesota. I think we do maybe have enough to be able to do this, and we're going to at least shoot for it, because otherwise you are sending people back out there with a chance to get this thing to get another foothold. And not only is it dangerous to people, all of the sacrifice that we made could be eaten up very, very quickly. A week ago when I showed the slides, keeping in mind Louisiana, we were worse than Louisiana at one point of quickness to 100 cases, and now they have blown up and gone off. Minnesota has been able to stay where we are because we're doing these things right. And what I want to do is I want to have the testing be a key pace that over the next 12 months to 18 months or whatever it takes to get a vaccine, we're able to stay on top of this. Basically, this is a wildfire that is still going to have some hot embers burning. And when those start to flare up again, we're going to have the fire department there to put them out immediately. And that's what testing does.
Governor, if I may, I know that long-term care residents and health care providers are getting priority in testing right now. This would be the molecular, I assume. But how soon do you think you're going to be able to get either that or the serology testing implemented in terms of food processing facilities, specifically in Minnesota? Have you got an idea of time? Is that going to be a few weeks, or what do you think?
Well, it's a priority, and that was kind of my vision when I laid this out, over a month ago, that I could envision us, testing all of JBS or Hormel or whatever the processing facility was. And I am, again, I think it's important to set goals, and I think it's important to do this publicly because I'm not worried about the risks of setting an ambitious goal that all the experts agree we need to get to, but is going to be hard to get there. Again, I would go back to Tim pointed out, if you look around the country, nobody's been able to do this, and it's been really hard. We're going to have to. So my goal is with you is when I talk to people, Bill, I'm talking with a sense of immediacy. Within the next week or so. These are things that I wanted to happen during the stay-at-home order. That's what we asked people to do. You stay at home. We will ramp up the hospitals. We will ramp up the ventilators. We will build the alternate care sites, and we will figure out how to do testing and go out there and search for PPE. I believe we're doing that, and so my expectations with this team is to get this up as quickly as possible. And I think you're right with these employers. We're going to have a very science-based strategic plan on when we get ready to start to move folks back into the workforce safely. It's going to have to be in coordination with us having the ability to do this with them. So I want that sooner rather than later. So I would tell you that I want to start seeing pretty significant results within the next week or so.
Thank you, sir.
Governor, we've got to wrap there for today. If you have any final thoughts on the call.
Sure. Once again, I want to thank everybody who's on here. I will make a plug again. If you have not seen that beautiful video, I don't want to set expectations because I think we all know that stadiums packed with Twins fans are not going to come immediately, but they will come. And all of the good things about Minnesota. And I want to thank all those athletes who took the time to make the case for us to just stick together for a while here, and we'll get through this. And that sticking together for a while, the story I wanted to end with today if any of you have not ever got a chance, I would encourage you all to do it, to visit one of our state veterans' homes. They're stretched from Laverne up to Silver Bay and across the state. They are wonderful places that wonderful people care for are heroes. And up in Silver Bay, there's a veteran up there, an 85-year-old named David, Korean War veteran, and his wife visits him every day until the COVID-19 situation. And I want to send out a real thank you to the staff at the Silver Bay Veterans Home. They got David an iPad, set him up, and taught he and his wife how to use the Skype system on there, his wife Barbara. And now David and Barbara, who have been married for decades, are able to continue to share their love with one another and make sure that David is taken care of there. So David and Barbara, thank you. David, thanks for your service to the country. And the Silver Bay Veterans Home and all those veterans homes across the state, thank you for caring for our warriors, and thank you for keeping them safe. We are grateful. Thanks, everybody. We'll talk again tomorrow.
Ladies and gentlemen, this concludes today's conference call. Thank you for participating. You may now disconnect.